From 1981, when the AIDS crisis began, until 1985, none of the major political, scientific, or social authorities in America made any attempt to educate the public on AIDS prevention. The only people who were willing to offer this information was gay men. By looking at the early awareness campaigns, I will demonstrate how the responsibility of disaster management shifted during this catastrophe. Bobby Campbell was one of the first real AIDS activists who started campaigning before the disease was even named. In 1981, Campbell became the 17th person to be diagnosed with KS in San Francisco. A practicing nurse himself, Bobby posted pictures of his lesions on the door of a popular pharmacy so that other men with his condition could get help. By 1982, Bobby had not only become infamous for being the KS poster boy, he also helped write one of the first safer sex guides with the Sisters of Perpetual Indulgence, a non-profit drag group. Under the name Sister Florence Nightmare, RN, he distributed this guide, Play Fair, throughout the gay community. This was the first document of its kind in America. Most importantly, Bobby Campbell started the People with AIDS movement with Dan Turner in 1982. With the PWA movement, Campbell had the opportunity to cross the country and unite other AIDS activists with the Denver Principles in 1983. He also got to speak at the DNC in 1984, only a few months before his death. The Denver Principles remain the greatest legacy of the PWA movement, and indeed of all pre-1985 AIDS activism. Drafted during the Denver Conference, these principles assert the rights of people with AIDS to identify, live, and die as they wish. Bobby Campbell would spend the last year of his life traveling to hospitals and explaining these catastrophic rights to them. Along with asserting the rights of people with AIDS, the Denver Principles marked a definite shift in the responsibility of disaster management, from regulated authorities to representation by informed minorities. Not only did it provide PWAs with suggestions for managing their own disaster, but it also provided non-PWAs with ways of conceptualizing this catastrophe. One of the major activists at the Denver conference was New York's Larry Kramer. Kramer established the gay men's health crisis in 1982 with the goal of ending the AIDS epidemic and uplifting the lives of those affected. He would later go on to found the more militant ACT UP, inspired by Campbell's actions. Both Campbell and Kramer participated in a monumental CDC meeting that took place in Washington in 1982, where they positioned the CDC to change the name of the disease from gay-related immune disease. After this change, the CDC managed to find instances of AIDS outside of the gay community. Richard Berkowitz and Michael Callan were also important figures in the early AIDS activism. Inspired by Campbell's rhetoric of self-empowerment, they brought a San Francisco model into New York and began the spread of activism across the nation. They too were present for the signing of the Denver Principles. Berkowitz and Callan were also inspired by Campbell to create their book, How to Have Sex in an Epidemic, the first real example of sex education that was both sex-positive and medically accurate. Reviewed by researcher and physician Dr. Joseph Sonnabend, this text recommends the condom use, getting tested, and other modern forms of safe sex that were not being discussed elsewhere. Meanwhile, the responsibility of disaster management wasn't always shifted away from the authority. In places like the San Francisco General Hospital, for example, they revolutionized their model of care to treat AIDS patients more effectively. Even these models, however, relied heavily upon voluntarism. In most other ways, however, the medical community failed PWAs, especially in those first 5 years. As I mentioned before, they first named the disease gay-related immune disease, which biased researchers, health professionals, and the public for years to come. It was only in 1982 when they changed the name. By 1982 as well, French researchers at the Pasteur Institute managed to isolate the viral cause of AIDS, which they called lymphadenopathy-associated virus, or LAV. Dr. Luc Montagnier, the leading researcher of the team, filed a patent claim on the virus immediately after. He then sent samples to Dr. Robert Gallo. In 1983, Dr. Robert Gallo published his own paper which stated that he had isolated the retroviral cause of AIDS, which he called HTLV3. Secretary of Health Margaret Heckler announced this discovery in 1984 without crediting the French researchers. Over the next year, French and American governments were involved in several bitter lawsuits on their respective patent claims. President Reagan was notoriously uninvolved during the AIDS crisis, only mentioning the disease in 1985. Before that, he refused to speak about the gay community or to the gay community, and his press secretary was even heard making callous jokes about the disease during a major press conference. The president and the government's involvement allowed for all kinds of misconceptions and misinformation about AIDS to develop in society, even when scientific research proved them incorrect. Fear and stigma ruled almost all conversations about AIDS, and most people only started to pay attention when AIDS was deemed a threat to heterosexual people. It was only when Rock Hudson died in 1985 that the discussions around AIDS really changed. Not only did he expose the issue to the public eye, but he also dedicated his savings to start AMFAR, which is still one of the leading organizations for AIDS in America. A close friend of the Reagans, the president addressed the AIDS issue following Hudson's death. Reagan put Surgeon General C. Everett Koop on the issue after 1985. After full investigation, Everett produced a pamphlet called Understanding AIDS in 1987, in which he made recommendations similar to the ones on how to have sex in an epidemic. Not surprisingly, these suggestions were completely ignored. Overall, these early public awareness campaigns really illustrate the ways that disaster management became the domain of the most vulnerable in society and the most affected. Gay men and other people in the most marginalized positions had to take action in ways that authority structures simply didn't seem able to at the time. The major contributing factor to this shift in responsibility was the social taboos attached to this disaster. These bring up a lot of interesting questions in what it means to bear the responsibility of disaster management, and who does this blame fall to at all times.